One start. Okay, now, so today we are going composed of two major parts. We do have the medulla. Okay, now, you know that the regulation of the adrenal cortex, action of the cortisol. Now let's talk about the malfunction of the adrenal. Now, what will be the sign of an acute? That's the Waterhouse-Friderichsen syndrome. That's due to the chronic adrenocortical insufficiency relatively is. Let's look at the first case. We do have a 17-year-old girl presented with the vagal abdominal discomfort for 6 months. She had noticed occasional diarrhea, but had no passed any blood. She admitted to weight loss, 6 kilograms, and anorexia. On examination, she was obviously pigmented, although she thought this was sun-induced. However, her buccal mucosa and gums were also brown. That's a very important one. If you want to see any kind of discoloration due to, for example, the excess of the ACTH effect, MSH effect, not the skin, but the buccal area, it's very important, because if you do have any kind of pigmentation in the buccal area, you can see it, and this is not sun-exposed area for sure. Now, if you are looking at the lab results, you do see that the serum sodium is low, potassium is high, the serum cortisol was low, and the ACTH stimulation test was impaired, and they detected some antibodies against the pancreatic islet cells and the thyroid microsomes. Now, we did have the white Addison disease. There are two types. If you do have the adrenocortical problem, that be a brown skin, and that should be the brown Addison. And if you do have the pituitary problem, that's a white Addison disease. Adrenocortical failure, for example, can develop if you cease the glucocorticoid therapy. So if you stop administration of the glucocorticoid, relatively, that can induce an acute adrenocortical failure. It's not a Waterhouse, but that should be a iatrogenic cause. And if you do have an autoimmunity that is very slowly destroying the adrenal gland that causes pigmentation, is due to relatively the increased ACTH synthesis that is partly by the pro-opiomelanocortin, that's a part of MSH, but don't forget the ACTH itself has an MSH sequence in it, so if you do have an excess of the ACTH at a long term, that can color the skin. Now, as you see here, the skin manifestation or the buccal manifestation change the distribution, so due to the androgenic effect, that can be, for example, the mustache and other girls, GI disturbance, diarrhea, abdominal pain, muscle weakness, as we mentioned, and hypoglycemia, hypotension, postural hypertension, weight loss. So these are the very common features of the adrenocortical insufficiency. As we saw in the patient, for example, the serum sodium level is decreases, potassium level increases, and the kidney usually is shut down due to the GFR, decreased GFR, dehydration, vascular collapse due to the missing of the permissive effect or the catecholamine effect. So relatively, these are the some that could happen. Usually not the all clinical features you can see, but if you are lucky, maybe from the GI or maybe the buccal discoloration, immediately you can diagnose it. Now, it was a famous patient, this Addison disease, this John Fitzgerald Kennedy, and before and after the treatment when they figure out that they have. Now, these are the cause of the Addison diseases. Mostly about 90% of the cases that's an autoimmune. And this is why if somebody has, for example, type 1 diabetes or Hashimoto thyroiditis or any other autoimmune origin diseases, they have a higher chance that they develop, for example, Addison disease as well. Now, next one, the relatively rare one, the degenerative amyloidosis, for example, the drug, ketoconazole, for example, can cause infection. Mostly tuberculosis, a secondary tuberculosis or HIV infection. Secondary can include, as I said, the white Addison, when we do have the ACTH decrease and the hypopituitarism, and other one, adrenal. Now, the secondary adrenocortical insufficiency, this is now what we do have in investigation, for example. Now, adrenaline crisis, when, let's see another one, another case, what can be the answer? Let's look at, they measure the hormone levels, and out of the, now, dexamethasone, in the practice, for ACTH. Now, these are the summary, and we already discussed the cortisol. Yeah, because the most common one, as you see here, the now Cushing, the pituitary adenoma, about 90. Now, what we do have when we do have Cushing disease? Now, here the scheme, what will happen? Now, ectopic ACTH syndrome, as I mentioned, we do have. Now, here you can see that the scheme, that when you do have an ectopic adrenal tumors, again, yeah, this is the same when we do have the. Okay, the next case, we do have a patient, he's a 41-year-old Caucasian female, who was admitted to the hospital for evaluation of the high blood cortisol level. Her complaints were fatigue, weakness, lethargy, decreased concentration, and decreased memory over the last 18 months. She also gained 40 or about 20 kilograms over the last 2 months, with central distribution of weight gain and neck obesity. Physical examination was remarkable for the Cushingoid appearance, with body weight of 110 kilograms, palmar erythema, and hirsutism. Lab values, dexamethasone suppression test results were consistent with Cushing disease. This can happen, very rare, but can happen. MRI examination of the pituitary did not show any abnormality. However, the CT scan of the chest with a contrast revealed a left upper lobe lung nodules measuring about 1.5 centimeter. So, in a life, you can find everything. So if you cannot find a tumor, you should look at, let's see, the gland as well, or the lung and another area, especially when the ACTH level is high. Doesn't matter if it's suppressed or not. This can happen. Okay, mineralocorticoids. Now, the mineralocorticoid. Now, when we do have excess, as this is called the, see, that was the 11 beta hydroxylase, the precursor. Now, secondary mineralocorticoid excess. Now, this is only the summary of what will happen when we do. Another case, 6-year-old boy. Now, they measure the testosterone levels, they measure the hormone level, as you see. And this is possible, this is called the adrenogenital syndrome. I don't have another graph. The blue one. There are two enzymes. One enzyme, the 11. Now, this is the most common one, the 21 hydroxylase deficiency. And this is what I mentioned. There is no 21 hydroxylase, no cortisol. Okay. This is what I mentioned. Especially in young one after delivery, this is why it should be measured in a very, the symptoms very similar, except we do have deoxycorticosterone, so we do have, where is, okay, due to the doc. Medulla. If we do have, now this pheochromocytoma, you haven't studied in pathology, this is what. All right, so that guy had pheochromocytoma, he was on the death. How can we prove it? Relatively, you could measure the catecholamine level, but only